Hi, and welcome to Falcon Physician Reviews. My name is Dan Yano, and I'm a neurologist, and we'll be covering biostatistics. Within biostatistics, we're going to cover variables, distributions, hypothesis testing, clinical trials, as well as epidemiology. We'll begin with variables. There are two broad classes of variables. There are qualitative or descriptive variables and quantitative or numerical variables. Within the category of qualitative, variables can be nominal or ordinal, and within the category of quantitative, variables can be discrete or continuous. We'll describe these more fully in the subsequent slides. Qualitative variables, as mentioned before, can be categorical or ordinal. Categorical variables are often referred to as nominal variables. Nominal variables are used to describe things or situations that can be put into discrete groups. So for example, sex can be described as male or female. Blood types can be A, B, AB, or O. And often when these variables are used, they are put into proportions, such that they are described as the number of items in a particular category over the total number of items. So for example, the patients with blood type A over all of patients. It's important to be able to recognize these types of variables because it will determine the type of statistical test that will be used to test whether or not certain percentages are larger than others. Nominal or categorical variables are often displayed using either tables or histograms, frequency histograms. So shown on the bottom left is a table of various blood types, the number of people with those blood types, and the proportions of those blood types to the overall number of subjects tested for blood type. Those data can also be presented as shown on the right, on the bottom right that is. This is a frequency distribution or a frequency histogram for the various blood types. It's important to recognize that there is no natural ordering of these categories. Shown on the bottom is the order of A, followed by B, followed by AB, and then by O. One could just as easily have reordered these to have a different order of variables on the bottom. There is no natural order to these types of nominal variables. In contrast, ordinal variables are also categorical, but they can be ranked and ordered, for example, least to greatest, best to worst, etc. So for example, anemia can be subdivided into various categories, mild, moderate, or severe. And here there is a natural ordering to these, and one would plot these on a graph as mild, followed by moderate, followed by severe, or potentially in the reverse order, but one wouldn't plot moderate followed by mild followed by severe, at least not typically. Cancer similarly can be staged according to the size and the degree of spread. So for example, stage 1, 2, 3, and 4. It's very important again to recognize variables as being either ordinal as shown here or nominal as described previously, because this will determine the type of statistical test that can be used to study these variables. In contrast to the qualitative variables previously described, we also have quantitative variables. When using quantitative variables, these variables can be used to describe things along a measurable scale. So within these groups, you can calculate some sort of descriptive statistics such as a mean or a standard deviation. If you think back about some of the categorical variables before, you cannot calculate the mean of blood type, for example. Within the general class of quantitative variables, we have two different types. We have discrete variables and continuous variables, and those will be described in the subsequent slides. Discrete variables are found in numerical values that are equal to integers, meaning whole numbers, and there are no in-between values. So for example, the number of children. Nobody can have some non-integer value of the number of children in an individual group. There are no half babies, for example. Number of fractures, number of risk factors. You can't have, for example, 1.5 risk factors for a particular disease. In contrast, continuous variables can have values that are on a continuum with an infinite number of in-between values. For example, age, height, blood glucose. Now one might say, well, age is not really a continuous variable because people have defined discrete ages. Somebody could be 16 years old or 17 years old, etc. But one could subdivide age as precisely as you wanted. You could define somebody based on the number of months old they are, days old, seconds, milliseconds, microseconds. So for that reason, these values, because they could theoretically be subdivided with any level of precision that you wanted, are called continuous variables. That concludes our description of variables.